Colleagues, well, welcome you. We're going to continue our working day. Now we're going to talk about the partnership of volunteers in the Ukraine's second medical mission in Ukraine. Participating were Oksana Syvak, Chairwoman of the board of the NGO Plus, and Dr. Ulyana Suprun, Director of the Humanitarian Initiatives of the Ukraine World Congress. You have the floor. Thank you. Good afternoon. Ulyana Suprun, Director of the Humanitarian Initiatives of the Ukraine World Congress. In May 18 through 17, we are going to have the visit of the second surgeons mission to Ukraine, who are going to operate those who suffered as a result of the Maidan calamities and those who are wounded in the ATO zone. The first mission took place last year in August, last August. That mission included, during the work of that mission, 37 patients were operated, reconstruction of the facial skull and face. This time, Canadian surgeons are going to come here, who are going to make operations. Those patients who require reconstructions after traumas, or let's say reconstruction of their arms or hands as a result of a traumatic experience. Now I would like to turn the mic to Oksana Syvak, who is the Ukrainian medical officer, who deals with the, let's say, gathering the patients, so that we could have a big number of the Ukrainian patients who need badly the medical assistance, and Canadian doctors come here to do that. Oksana Syvak, I'm a physician. I'm going to help to select the patients together with my colleagues from different regions and cities of Ukraine. Each and every patient can directly approach us, and to apply to that, they have to put in writing their problems, which will be resent to Canada, where they will assess the required help to be given to this specific patient. There will be 3 surgeons, maximum facial surgeons, plastic surgeon, and the experts in the mini surgery to restoration of hands. This mission doesn't include neurosurgeon. The team of medical officers will be prepared to work for the full 5 days, working days, in 3, let's say, operation rooms based on the military hospital in Kiev. This is going to be the joint effort of Canadian surgeons together with their Ukrainian colleagues, shoulder to shoulder, so to say, which spells the assistance to be given to a patient and mutual exchange of experience. In the future, this is not going to be the last one. This is not the last project. That's why the Canadian team asks kindly other patients to apply and tell their requirements who have different kind of trauma, so that they can include in the composition of the next mission other experts or professionals as well. So anybody can apply, but I would like to emphasize that we are going to have the effects and the information in the arms and hand defects of soft tissues of face and the head, skull, any kind of defect of nasal, let's say, cheek, bones, any kind of firearm wound of the face, and then any post-traumatic defect of the face. Those patients are going to be examined, and they will have medical help if they would require later the further reconstruction. Maybe it will be done later, but anyway, everybody will be offered the assistance. So please, you can call us at the contact telephone number, which is it's 067 407 87 07. As we can see now, we are approached both by the physicians or surgeons from different hospitals and individual patients who already have been, let's say, who had been treated in hospitals and were and when home, they can directly approach us by this phone, or the volunteers who take care of those guys can do that for them. We'll be happy to help you. Also, I would like to say a few words about the Canadian Ukrainian Foundation. This is been a charity fund foundation which for many years has been in existence in Canada. They had a lot of fundraisers in order to collect the necessary money to pay for the treatment of different patients. Those surgeons who come here, they do it on a voluntary basis and they are not paid for that. We had the fundraisers, among those the Prime Minister of Canada, Stephen Harper, came to help Ukrainian soldiers and those who suffered during the Maidan revolutions to be operated. We are in close cooperation with Ukrainian Canadian Foundation, which is a very good organization which provides assistance not in this sphere but in the sphere of psychological assistance and aid to offer to our soldiers in other spheres. This foundation is headed by Viktor Hetmanchuk, a representative organization which is going to be to take care of this project. Christina Waller, who is going to visit Ukraine next week, and we expect your feedback so that the patients give their consent, so the physicians give their consent. We would like to assist you as much as possible. This means also the exchange of experience and the assistance rendered or help rendered to those people who are defenders of the motherland, who were wounded while defending the Ukrainian nation, Ukrainian people. The idea of that mission so first yet in April last year, when a team of physicians came here and made the assessment of the requirements, medical requirements in Ukraine. In those days, they saw that there are quite a lot of experts who can take care of those, let's say, of those cases which they saw. But we are talking about reconstruction and surgery of face and skull and face, maxillary facial surgery. Show that we can cooperate with our Ukrainian colleagues, like Antonishin, who is an expert in this specific specialization. He will be the head of the mission, and he collected or gathered not Ukrainian Canadians, but those Canadians who have no connection or tie with Ukraine, but they really wish to come here and give a hand. Again, this is being done on a voluntary basis. They are not paid for their efforts. They are coming here for 10 days in order to help and exchange the experience.
Thank you very much for your presentation. You are doing really very good business in Ukraine, and you are doing what is mostly needed. And we see how Canadians assist Ukrainians. And now we have Q&A session. I'm Stetsuk from UCMC. As far as I understood, for Maidan participants and for servicemen, this assistance is free. What documents they should supply, or their military card, or what? Actually, we do not request for a military registration card, and we have a lot of volunteer battalions, and in those volunteer battalions, servicemen are even not registered as ATO participants, etc. What we need all medical documentation. We need to have the medical card, description, diagnosis of the status of the patient, etc. Canadian doctors would like to get all necessary information in advance to be prepared to be ready and to bring something with themselves. Of course, we won't check military registration cards, and of course, this will be provided free of charge. This will be done in the military hospital in Kiev. Those who belong to the armed forces of Ukraine, they are registered in the military hospital obligatory, but nevertheless, those who are volunteers or those who belong to other enforcement agencies except armed forces, they nevertheless will be provided with this very specific assistance. Thank you very much. And we wish you a lot of success. Would you please again show the telephone number 067-407-8707. This is the hotline number for those who would like to be treated during this May session, and our website is E+ Initiative. You can find us on Facebook, where we have full information, full description, what types of patients we are inviting this time, and please, you're welcome. Also, UCMC, how many patients do you plan to cure during this session? We have 3 operational rooms. This could be 3 patients operated at a time. As for the total number of patients, we are unable to predict. We have received 22 requests as of today. We will review them, and among those 22 patients, there are some patients who will receive just consultation this time and will receive a piece of advice, because we won't have traumatologist or neurosurgeon in this mission, and that's why we invite other patients to come. Last time we had 37 operations and treated 30 people, because some patients required several operations, and our surgeons worked 5 days a week, and our doctors from Canada invite the previous patients to attend this time, and some of those patients who were treated during previous mission, they will require further treatment, and they're invited for this session too. So during this mission, they will carry out surgery operations and provide consultations on further problems, and those patients who will need other specialties, which will be presented during this mission. Then during further missions, we will either bring other specialists or provide teleconsultations for the other people. Thank you very much, and